I'm Dr. Nicholette Erickson. I'm a medical oncologist, and I come to the Rumford Hospital every Tuesday, where I see patients for treatment of cancer and blood diseases. Great. Well, I see patients who have been diagnosed with cancer, and we plan treatment, and we have an infusion center where we administer treatments. I also see patients for evaluation and treatment of blood disorders, which may be benign diseases like anemia. We give transfusion support in the infusion center as well, and some blood disorders which may be malignant diseases as well. Typically, a patient may present either from having a screening test done, like a mammogram or a pap smear, that may lead to an abnormal finding, which would lead to a biopsy, or they may present to their primary doctor with a complaint or a symptom, which may lead to a test. Once we determine that there's a suspicion for a cancer, then typically a biopsy needs to be done, which may be done by a surgeon. Sometimes that might be done in the X-ray department. Sometimes it might involve taking a sample of bone marrow, which I do in the clinic. We have several meetings that occur every other week or monthly, where surgeons, the radiation therapists, medical oncologists, radiologists, and pathologists all sit down and review cases. We have special meetings dedicated to patients diagnosed with breast cancer. We have separate meetings that are dedicated to discussing patients who have diagnosed cancers of the lung or in the chest region, and another meeting for gastrointestinal malignancies. And so it's an opportunity for all the doctors to share information and share ideas, discuss treatment plans, and make recommendations. I mean, one of the things about oncology is that it's very evidence-driven, so there's a fairly standard process for how to proceed. So step number one for any patient is establishing the diagnosis. Once we've done that and we know what the diagnosis is, then our next step is to determine how big is the problem or what stage is the cancer. And there are national guidelines that will tell us exactly what are the tests that should be ordered and how to interpret that. Once we know what stage the cancer is, then again, there are guidelines nationally for the best treatment options. And we may individualize that for a given patient depending on their other medical problems or their health. So you can never take away the opportunity to have it personalized. But I love coming here. I think it's incredible support for the patients to be able to get their treatment close to home. It allows their family to have less interruption of their lives, and it just makes the process a lot easier for them. But the other thing that's nice is it does make the process of getting more specialized services at CMMC a little bit more seamless, because I already know them. I know exactly how to direct them to the right place. There's the Dempsey Center, which provides supportive services, radiation therapy, which of course needs to be done in Lewiston. There may be specialized types of surgery that would need to be done there. But the bulk of sort of day-to-day treatment and follow-up can be done right here.